Are you ready to tell?
My name is Alberta Edimandamte. I know October has been set aside for breast cancer awareness creation. Yes, I have been doing it periodically, basically every month I do it. And then what is really recommended is that you screen the breast for any lump or anything that looks abnormal, especially 1 week after your menses. After menstruating, the first 1 week, it is recommended that that is when you can do the breast examination. So what I know is that you can do the breast examination yourself, or you can access any health facility that we have in our country, and the nurses would also be available to help you screen the breast for any abnormalities for prompt interventions, because I know early detection can really save your life. Thank you. For my husband, well, specifically, he doesn't really help me, but you know, as he plays with the breast, if there are any abnormalities, he draws my attention and then I take the necessary action. Okay, so for the men, you have to keep reminding us, because when the health court comes, it doesn't come to just the woman, it comes to the man and the woman as well. Imagine living in your home, your family, your kids, and your wife is sick. It's going to drain the finance of the family and then the time, who takes care of the children. So remember, the here is to keep reminding us, keep us on track. Keep reminding us to keep examining our breasts so that at least the early detections can come, because the little I know about breast cancer is, although it is deadly, it's curable. Once it's detected early, breast cancer can be treated and women can be free. So for especially in October, I know we'll make a lot of noise about breast cancer, and a lot of women. Now I know the health sector, what they seek is to empower the women, especially, so that at least the early detections, as I said earlier, yes, we can pick them early and then cure them and treat them as well. So as a nation, we are going bit by bit, we will get there.
It's a condition that affects most women than men. And what I can conclude on it is that this month, which happens to be breast cancer awareness, is very, very important as far as ladies are concerned, because breast is part of our body, and therefore if there's any kind of problem affecting the breast, then it becomes a stigma. And so we also have to involve those who have gone through this condition and have survived, so that they can also share their experiences, so it can serve as hope and inspire others to also, even those who are already having the condition, it will inspire them to know that, oh, that is not the end of everything. Some people have gone through and they have survived. So we need to also involve those who have gone through the condition and have survived, to inspire others, for them to get hope that indeed there is a future for them. Sucking of breast milk, in fact, before the man even sucks the breast, is let me say, is an intimate relationship. That's you can do that, and therefore I believe the man will fondle with the breast, and by so doing, it even helps to detect if there's any abnormal lump, and that can even help for early detection. So sucking is not a sin, or it's not anything that can create a problem. In a way, it helps the men to also detect early forms of cancers and help the women to get remedy as soon as possible. Mm-hmm. So it's not medically, it's not. But if the mother is actually breastfeeding, then the opportunity should be given to the baby to actually breastfeed until such a time that the breast will be, the baby will be weaned off for the man to also continue.
You know, when you say breast cancer, it's basically about cancer that actually attacks or affects the breast of women. And it has caused a lot of deaths and havoc to individuals and families, not only in Ghana, but across the globe. So that is why it has become a topical issue for every country. So that is what I would say about breast cancer. Yes, I would say an emphatic yes, because men and women are almost two sides of the same coin, and whatever happens to a woman directly or indirectly affects a man. So it is not a business that is, or it's not an issue that is related to women, even though they are the victims. We also have to help as much as we can. Well, in my candid opinion, the advocacy is enough, because almost every year we actually, dedicate months and times to celebrate it. But I think that we should look at more practical solutions in terms of going down to the people and let them know that these are major causes and these are the ways of preventing it. So I think that.
And there you have it. We've entered the 10th month, October. It's a special month. We go pink. It is identified as the leading cancer-related cause of death among women. And with Ghana as part of the countries to bear the heaviest burden, the brunt of it by 2050, the month of October is set aside as the Breast Cancer Awareness Month to bring to the fore the existential threat the disease poses to our women and the need for them to be more conscious and pursue the necessary actions to avoid fatalities. And I might as well add men as well, because there's a small bracket of men who also end up developing breast cancer, about 1%, in Ghana slightly higher. So on this pink morning, we dedicated to breast cancer awareness, and all we need to know about it as we launch the Breast Cancer Awareness Month on the AM show. And my guests this morning joining the conversation, it's heartwarming to have a man in the middle, Professor Joe Nat Clegg Lamptey, Professor of Surgery with the University of Ghana Medical School. Dr. Nadoko Aite is a Senior Specialist Oncology and Radiotherapy at the Korle Bu Teaching Hospital. And we also have a survivor. Remember that song from back then? I'm a survivor. No, it's not Destiny's Child. It's Barbara Dowona. She's a breast cancer survivor. It's so good having all of you in the studio.
Thank you.
Thank you.
All right. But before we get into the studio, before we get into the talk, let's contemplate some data as far as breast cancer is concerned, some statistics. Let's get to that shortly, and we'll be walking you through some of the things you need to know when it comes to breast cancer. So there you have it. 2.3 million cases of breast cancer occur every year, and the source there, the World Health Organization. Of that, the death toll, 670,000 if you're looking at the year 2022. 670,000. That's a staggering statistic. And you would also realize that 99% of breast cancers occur in women. So it leaves about 1%. The men must feature somewhere, right? So the men are also in there. 1%. And if you look at this, 0.5% to 1%, like I said, occur in men. But in some areas, they are more prevalent than in others. So in Ghana, for example, when I was having a chit-chat with Prof before coming on air, it was clear that we had over 1%. Let's just go back to the last slide so I can. And in terms of the targets, to reduce global breast cancer mortality by 2.5% per year, these are general targets. Reduce breast cancer deaths globally by 2.5 million between 2020 and 2040. I'll be speaking to the experts to find out where we are on that trajectory. And finally, 4,500 cases per year in Ghana, 4,500, and 50% of those diagnosed cases result in, unfortunately, death in Ghana. So those are the staggering and, I should say, horrifying statistics that we have as far as breast cancer is concerned. Guests, good morning one more time. Thank you for joining the conversation.
Good morning. Thank you.
I'll start with you, Prof. I know you've been on this beat for quite a while, Doc as well. A lot of work that has been done. But break it down for us. What exactly is breast cancer? Let me start with you, Prof.
Right. Well, first of all, what is cancer? Cancer is when you have the cells in your body. Cells are like the minute parts of our body growing out of control. Okay. Normally, the body has a system where cells grow, they die, new ones are formed. And when they grow out of control, then we say we have a cancer, because then it becomes a lump. As they grow, they get...
That's what I'm teaching.
Yes.
Cells, they've decided to do their own thing.
And then they begin to spread where they are, and where still they may spread through the blood vessels. And we call them lymphatics as well.
And maybe
once
to
they
your
do
organs,
that,
other
yes,
organs.
Once they do that, they go to other organs. And that's the danger of cancer. So basically, that's the problem with cancer, is that they grow uncontrolled and then they spread.
Is that is that the fancy thing that you call metastasizing or
Yes.
metastasis?
Yes, metastasis.
I have to be careful with that because this is a slippery slope.
Yes, it's a metastasis. That's when they leave the breast and then they go to other parts of the body.
I see. Is there anything you'd like to add on that?
Basically, that's it. So when that occurs in the breast, then that's breast cancer. And our worry is that, unfortunately, a lot of the patients we see come with such advanced disease. When that happens, then their outlook is not as good.
By the time they come, I think I've read some data that points to the fact that even in Ghana, there are much better outcomes when people discover early and come early, because then the chances of a fatality are reduced to the barest minimum. But once you come late, the damage has already
That's the problem.
caused.
In fact, a recent study by Dr. Ani and her colleagues compared outcomes for breast cancer patients who were seen in Ghana with early stage disease to that of the rest of the world, and the outcomes were the same.
Wow.
It's just that the proportion of people who come to see us with the early stage disease are too few.
Okay, so it doesn't matter. This is not so much about health systems and all of that. If you go early, you are very likely to
We are well
save-
established.
well established
Yes,
to do that.
to deal with the disease if you come early, yes.
But while it is important to check, it's not every lump you find in your breast that would probably be cancerous, because there are benign ones which are harmless and malignant ones. Tell us about that.
Yeah, so most of the lumps you find in your breast are probably not cancers. There
Okay.
are all kinds of things. When you are breastfeeding, you can have a lump grow in your breast, like a galactosile. You can have just a boil in your breast. So for majority of the women, it is not breast cancer. However, for the small proportion that is cancer, it's important. That's the reason why we have to assess every breast lump to make sure that the ones that are malignant are identified, and then we can intervene quickly. But most of the breast lumps are not malignancies.
I see.
And I want to say that most of the lumps that are painless are the ones you should worry about. More often than not, people are worried when they have a lump that is painful, and they will go to hospital for that. And breast cancers are usually not painful, and people would wait, watching to see if it will become painful. That's the only time they go to hospital. So usually it's a painless lump when it's breast cancer.
Oh, that's interesting.
Yeah.
So the painful ones usually tend not to be cancerous. It is the painless ones,
Yes.
and they will be developing slowly.
And that's
You
the
have
danger.
no knowledge.
And that's the danger.
Yeah.
Because people react to pain. So a woman has pain in the breast, even when you've assured her there's nothing, they will keep coming. But the painless ones, often they don't.
Let me come to Madam Doona and just find out, you are a survivor.
Yes.
You've been there, you've done that, and you've survived. We thank God for your life.
Thank you.
Tell us a bit about your story. And they are talking about early detection and all of that. What's your story?
Okay. 2020, that was January. I saw a lump in my breast, but I ignored it. And then 3 days later, as I was cleaning myself, I'm from the bathroom, wiping myself, then I saw it again. So I called my son, said, hey, come and look at something. And he said, hey, Mommy, what is this? So in fact, I decided to go to Herbal Hospital. Wow. So I went there, they checked, and they said it's mammatis, something, but it's not cancerous. So
That's what the herbalist told you?
Yes.
That it's not cancerous?
It's not cancerous.
Okay.
So I went there for 2 months. Then later, I have a nurse in my house. I called her to come and have a look at it. And she told me that I should go for mammogram.
Okay.
So the following day, I went to SNIT for mammogram. And when the result came, they said I have to take it to a hospital. There is a doctor, the woman in my house is a nurse, and she works at Achimota Hospital.
Okay.
So she gave me a doctor there. I showed the doctor my report, and she said I have to do biopsy. In fact, the doctor talked to me a lot, and he told me that if it's cancerous, I will have to go through chemotherapy, surgery, and then I'll be on hormonal treatment. Okay. So the day Ghana was sprayed during the COVID, the day Ghana was sprayed was the day I went for my biopsy report.
Wow.
And in fact, as for me, I'm very curious. So when I went for the results, when I was coming, I just opened the report and saw carcinoma. I said, what is this? So this
is not sounding good.
It is not sounding good. So I just Googled and saw everything. In fact, that day, I cried. So I took the report to the doctor the following day. And he said, Madam, you have cancer, stage 2. I'll give you a referral letter to go to Korle Bu. In fact, next month will be exactly 21 years. My mother passed through cancer. Wow. Her own was lymphoma. That is cancer of the lymph nodes. So I saw when my mother was going through chemo, I saw what she went through. I'm the only child. I have a cousin who helped me. I saw what she went through. So the time the doctor was talking to me, to be honest with you, I was saying in my mind that, boy, I don't know you, or meaning you yourself, you don't know what you are saying. Me to go to Korle Bu, no way. So after giving me the referral letter, I went back to Herbal, an alternative treatment. I did it for almost 10 months.
So you got the report.
Uh-huh.
You saw the carcinoma, you checked.
Yes.
And saw that per what Google was telling you, there was a cancer.
Yes.
You went to see the doctor.
Uh-huh.
He also emphasized that you had a cancer.
Cancer, stage 2.
Yet you still decided to go back to herbal medicine. Why?
I was afraid because the time my mother was receiving chemo, what she passed through before she died. So
is it the hair loss, the pain and all that?
The pain that she went through. She went through a lot of pain. May I so rest in perfect peace. Amen. So that alone,
it put you off.
It put me off not to go to Korle Bu.
Let me ask you this quickly. Today, on hindsight, looking at your own situation and what you went through and surviving, do you think you should have just continued at the hospital?
After the surgery, well, please, dear question.
Do you think, now that you reflect on it, the time you went back to herbal medicine, do you feel at that point you should have just continued at the hospital? You shouldn't have gone back to the herbal treatment?
Oh, okay. The herbal treatment that I did, my stage was stage 2. And when I went to Korle Bu, it was still stage 2. Okay. There was it has not increased, it has not spread.
But were they able to treat you with the herbal medicine? That's the question.
Okay, I went for some time and I left. So I don't know whether maybe they can treat or not, but I went to Korle Bu.
But did you see results?
That's what I'm saying, that it was at one stage.
Okay.
It didn't spread.
Okay.
Okay. That was what happened to me.
Okay. Hold briefly there for me.
Okay.
Just hold on.
Okay.
The herbal medicine bit. Okay. The reason I bring this up, and I always say that far from demonizing herbal medicine, a lot of the drugs we consume, the orthodox, the other synthetic and all of that, they have a base from herbal medicine. So no one is demonizing. The problem is where sometimes, like you said, you went and they said it wasn't cancerous, but it actually was cancerous.
Yeah.
Okay? You could have just been there and, God forbid, the unthinkable would have happened. And sometimes some of these institutions, there's no dosage. They are giving you everything put together. There's no recommended dosage and all that. You could end up destroying your kidney, livers, and other things. So let me come to you, Prof. Herbal medicine treating cancers, especially in this case, breast cancers. What do we know so far?
Well, We actually do not mind too much if they are used as complementary.
Okay.
Especially with those that have been well tested by, we have this Tetequashi
Right.
thing.
So complementary in the sense of side by side with.
Yes, we don't mind too much.
Okay.
But we have had too many cases of people who decide to go and use herbal medicine and they come back when it's too late.
Right.
We've had just too many to count. So
is that the usual trend? Is that what most people do?
Well, I won't say most, but quite a lot of people do. Quite a lot of people do.
And when you look at the fatalities, what happens usually when they do that?
Oh, it's always bad news. They always come back when it's worse. Even when they think it's improving. I've had somebody who said it's improving, the lump is getting smaller. After a few months, he came back and they had spread all over. So we certainly do not recommend it.
We certainly don't recommend it. And it's because of what I've also garnered in the past, which is why I posed that question. Is there any add-on before I bring Mommy back in?
I just think that it would be good if we had some form of collaboration with our partners. I used to call them competitors. But I think they are probably our partners because the truth is that most people are comfortable with them. Yes. Often they tell them, I can cure your disease. The doctor may not necessarily say that.
Right.
But the hope they give the patients, maybe as doctors, we should learn to give that hope to our patients as well. And if we work together, I think that our patients would be the better off if we work together with them. Because sometimes it's simple things they give them. Ginger. Ginger is good for when you are nauseous from chemotherapy. So that's not so bad. And if you do that, then you are doing it together. But to decide to do only herbal treatment, so far we haven't found any herbal treatment that is able to cure breast cancer. So if you do that alone, I'm sorry, the outcomes will not be good.
Okay, it's good we've put that out there, clearly. If you do that alone, then, sorry, but you know that, and we don't want you to be on that road.
Yes.
Now let me come back to you. So you went back to herbal medicine for 10 months, and what made you stop?
Okay, my son called my cousin in London during the Corona time.
Okay.
And my auntie's daughter, and he told him, my son told my cousin everything. In fact, I didn't tell any of my family members because everybody is passing through difficulties during the Corona time. So my cousin told my Auntie Henrietta Okante in London. So she called me and she asked me what was going on. And I told her everything. She said, so what are you doing? I told her that I'm doing alternative. She said, why don't you want to go to Korle Bu? I said, no. What my mother passed through, your sister, I can't go. So 2020, December, she came all the way from London because of me. Mrs. Henrietta Obley, God bless you for the impact you put in my life. If it was not because of you, I could not have known what have happened to me. God bless you. So she came and she said, no way, I don't have to do the alternative again. So I should go to Korle Bu. So they have a friend, a doctor friend in London called Dr. One doctor, I've forgotten his name. Okay. So they show her, they gave him my report. And he said, you know, one doctor here, Dr. Wellington. Okay. We are related to him, so we should go and see Dr. Wellington. So we went to see Dr. Wellington. He also stayed at Hachu, where I'm staying, with my report and everything. And he said that too, because I have delay with the referrer, so he will write something, a note on it, so that I'll take it to Korle Bu. So it was Dr. Wellington. He's dead now. May he so rest in peace. He wrote a letter on the referral letter. That day I cried. He said, cry everything. If I say you go to Korle Bu, you go to Korle Bu. So at the end of the day, there's nothing that I have to do, but I have to go to Korle Bu. Right. So I started going to Korle Bu in January 2021. And one thing that I always say that if you admit that you do the treatment, the day you start to say that you start the treatment, you're already a survivor. So that was what happened.
And that was your story. How long did it take you to deal with the situation? Because, like she said, doctors don't necessarily say they are going to cure you. But how long did it take to have an acceptable, level of,
Okay, I was given 6 cycles of chemo.
6 cycles?
Yes.
How long was that?
If you do it every 3 weeks.
Okay.
Every 3 weeks, you go for the next chemo.
Okay.
But I did 3 cycles, and I went to see the doctor. And normally, after every chemo, you have to go and do blood test.
Okay.
And they will check your blood. If you are on a level, then you can go for the next one. If it's very low, then you have to go in for another 1 week and do another test. They have the level that you have to get before you can go for the second or the third chemo.
Right.
So when I did the third one, normally when you do, if you have 6, you do 3, then you have to go and see the doctor so that they will see how far the chemo is working on you.
Right.
So I went to see the doctor, and he gave me a medical form to go and do a lab and bring it the following week. Let me say something. The time I was doing my treatment, I told God that if He heals me, I will not hide what He has done for me, but I'll come out and let everybody know what He has done for me.
Right.
So whilst I was doing my treatment, I was also praying. So I went to church, and one of my pastors told me that, Auntie Barbara, that was on Sunday. God said I should tell you that you don't do the chemo again. I held on to it, and I prayed over it. And on Wednesday, that was Sunday, Monday, Tuesday, Wednesday, when I came to see the doctor with my report, he told me that, Madam, you will not do the chemo again because the chemo you are doing is not doing any good to you, so you will do your surgery. So they gave me a letter for, I was transferred to anesthesia.
Okay.
So by the grace of God, I did the chemo only 3. And it was not easy. So I did my chemo 3 around April.
Okay.
So I went for the...
you went into surgery as well?
And I had my surgery on the 17th of June, 2021.
Okay. Let's pause there. Let me come to you, Doc. I know when you conduct these surgeries, it's pretty tricky because you want to ensure that any little elements in the cancerous tissue are out, because if not, they could redevelop. They could.
All right.
I don't know what the technical term is.
All right. So we must necessarily take the cancer out of the breast.
Right.
And there are 2 ways in which we do it. We can take the lump out with some normal tissue. Like you said, we have to make sure that all of the cancer
surrounding
that is
tissue.
evident, yes, is taken out with a little bit of normal tissue. Prof should be saying that he's the surgeon. But with a little bit of tissue to make sure that we've taken everything out. And that's useful when you have slightly big breasts with a small lump. So the maximum size we prefer is up to 5 centimeters. Then, if you have a tumor that is much bigger than 5 centimeters, it's the best way to manage the breast is to take away all of the breast.
To take the whole breast?
Yes, and that is what we call mastectomy. The reason is that for a larger tumor, it's likely that there's disease elsewhere. So taking away all of the breast will ensure that the disease doesn't come back within the breast. But in addition to the surgery, remember Prof said that the cancer can spread locally into what we call lymphatics, right? The armpit is the next junction for breast cancer. So as part of the surgery, we would do some form of surgery in the armpit.
Okay.
There are two things it does. It will tell us the extent of the disease. So the more lymph nodes that are involved by disease, the more advanced the cancer. But also taking the lymph nodes with disease away is also part of treatment.
Okay.
So we'll do that surgery as well. And then once all of this is done, depending on the stage of the cancer you have, we would have to do radiotherapy.
After it.
Yes, after it.
I know, okay, so correct me if I'm wrong. I know in some of these instances, maybe I may be transposing what happens with prostate disease to this. I know sometimes you have to do the surgery before you do radiotherapy or something of the sort. You can't do that before you go in. What is the issue?
Well, so all the modalities are available to you.
All of them are available.
The modalities are systemic treatment, which includes the chemotherapy everybody knows about, hormonal therapy, and some targeted treatments as well. And then there's the local treatment, which includes surgery and radiotherapy. So it's a combination of all of that. We can give you the chemo first, and if the tumor is too big, or for example, you have ulcers on the breast, when we remove the breast, we should be able to cover. So if there's a lot of ulceration, that might not be possible.
Right.
So we can give the chemotherapy. It will control the cancer, make it much smaller, so that we can have the
Then go
surgery
in
and close up. Yes.
Okay.
Sometimes we may even give radiotherapy first, because radiotherapy also has the ability to make the cancer smaller and take it off attached tissue. So
Okay.
the cancer can get attached to your chest wall. And
Wow.
radiotherapy can help detach it, correct, from the chest wall. So we can do that first as well.
Okay,
So
Prof.
it depends.
Right. I do know that when it comes to the breast, especially with women, because it's not restricted to women, there's a 1% men ratio in there. It's part of the optics, the cosmetic aspect, and that is one of the things that women struggle with the most when you tell them, owing to the size of this, your entire breast has to go. What are some of the experiences you had? And I do know, again, that there are prosthetic breasts as well. Can you share with us what the experience is and how it can be dealt with?
Okay. I think, first of all, like you rightly pointed out, because of the fact that you're losing a breast, some women don't come to hospital. And that's one of the reasons why they come late. However, as Dr. Aisi has just said, if they came early, they could have saved their breast. And that's the interesting thing. Because they are late because they are afraid they will lose their breast. Then they wait for so long that when they come now, they have to lose their breast, when they could have saved it.
And if you're not careful, you are saving the breast and losing your life.
Exactly. So, but what are the alternatives? Yes, you pointed out that there are things you could put into your brassiere and so on. And they are very, some of them feel like breast and so on. But we also do breast reconstruction for patients. Okay. So we work very closely with our plastic surgeons. So we have a very good team with oncologists, surgeons, plastic surgeons, breast nurses, and so on. So they can actually create a new breast when the breast is removed. And they can use the patient's own tissues, or they can use implants, or they can use a combination of both. So that can be done as well, either at the same operation or later.
Okay. So it's not a lost cause if you are thinking of the cosmetic effects. Save your life first. It's like the Bible will tell us, seek first the kingdom of God and all the other things. Save your life first. Yeah. Then you can think about how my breast will look.
We can get
moving
to another
forward.
breast.
Because God forbid, if you pass, the breast will be of no use, to you.
And there are other advantages that when the breasts are very large or very big, the reconstructed breast is often smaller. So you can actually have a reduction on the other side, so that you have become very,
nice breast.
Okay, so let's look at this. We'll talk about knowledge, but there are two things that Madam Dawuda mentioned that I want to get into. The role of genetics. She says her mother had it. What factor is it? And demystifying breast cancer. It appears people have all these impressions, not just breast cancer, the cancers, but especially breast cancer. And she also mentioned stage 2. I know in diabetes and others there are. Just briefly, we are pressed for time. I'll start with you. I don't know which ones you want to take first. What does it mean, stage 2 breast cancer?
Well, so stage refers to the extent of the disease.
Right.
And there are multiple things we use to assess that stage. The size of the breast, whether or not it is involving the skin or any tissue beyond the skin posteriorly,
Okay.
and whether or not you have lymph nodes in your armpit, and whether the disease has gone to other parts of your body. So various combinations of that will give us the various stages, from stage 0 actually to stage 4. Stage 0 being when the cancer is not invasive. So there's a precancerous type of breast cancer. And that is what we usually might find if we do regular mammograms, and that's what we advocate for. Yes, and then we go through stage 1, stage 2, stage 3, stage 4. Stage 4 being when the cancer has gone to other parts of the body, when it's not curable.
Okay. Doc, can we look at the role of genetics in this?
Yes, genetics is very important. There are some genes that we've inherited from our parents, which predispose us to certain things. So we have people, Abedi children will play football very well, and so on. And so the same way, you can actually inherit the tendency or the likelihood of developing breast cancer. That doesn't mean you will get it. The environment also plays a part. What you do, things that you expose yourself to, will also influence whether or not you get breast cancer or not. But yes, unfortunately, some people have this tendency, and therefore they have a higher risk of developing breast cancer.
So especially with such a history,
Yes,
you have to be even more
more careful.
careful.
Especially if you have more than one person. Maybe your mother had it and a sister has had it, another generation had it, then it's likely you have that gene.
I'll come to final bits, knowledge every woman, every man as well should know. Of course, the men are also, help your mother, help your sister, help your wife, your girlfriend or whatever to do this. But I just want to find out, Madam Dewona, do you still check your breasts regularly?
Yes.
I'm sure you do so more regularly now.
Regularly.
Kakrana, if I would yes, right now.
Yes,
Yeah.
So normally when we go for to see the doctors,
Right.
every year you have to do mammogram.
Okay.
So for instance, next month I'll go to radiotherapy to see my oncology.
Okay.
So I have to go and do mammogram.
Okay. Please keep it up. Yeah? Okay.
I don't joke with it at all.
Great.
I'm always checking my breast.
Yeah.
That's great.
That's what I've been doing.
And I would that all were doing
We're
that.
doing.
Prof, how often should women check their breasts?
I think she referred to doing mammograms. So yes, so that's important. Above the age of 40, we
Right.
say have a mammogram once a year.
Once a year.
But not just that. After the mammogram, see a doctor as well.
Okay.
Because believe it or not, mammograms are not 100% accurate.
Right.
And sometimes the mammogram may say it's normal when there is something in the breast. So it's good to have it examined as well.
Okay.
Now the patient herself, or the woman herself, or the man, must also examine themselves. Once a month, we say. Because in between the yearly checks, something can
happen.
breast. So if the person is checking themselves once a month, for those who are having their periods about a week after the periods, just check yourself. And if you notice any change, there are many things to look out for. But basically, if you notice any change, then see your doctor.
I'll give you 30 seconds each for wrap-up comments. But Madam Dewona, if there were one thing you could say to the women, especially the women watching, what would that thing be? Very brief.
Thank you. What I'll say is that, please, ladies over there and women, try as much as possible to be checking your breast every month. If you see any lump, any change at all in your breast, please go to hospital and follow doctor's advice. They will check it for you. If it's anything, it's not every lump that is cancerous.
Right.
If the doctor see you, what they have to do for you, they will do. Because early detection saves lives. And don't put fear and panic in you whenever you see something. You go through it. Thank you.
Thank you so much. That was very informative. Go to hospital. Check. Go to hospital. Don't be afraid. Right. Prof, final words?
Yes, the same
Doc,
thing.
I know I've left you out for a while.
Don't worry.
Yes. I think Dr. Isaac said that we are well equipped in this country to treat breast cancer as well as anywhere else in the world. If you have breast cancer, come, and come early. and you are more likely to be saved.
Okay. Doc, you have the final bit. I'll be more generous with the time. Go
Thank
ahead.
you.
Final words.
So both Prof and I believe that one of the biggest problems with breast cancer is stigma. And one of the ways to counteract that is if people have knowledge. People are scared of things that they don't understand. I don't know if you've heard, they say if you give something to somebody, they don't know what it is. They will look at it. If they don't understand, they will hit it on the floor and they'll probably try to bite it. It's only because we don't understand. And so Prof and I have come up with a book, A Guide to Breast Diseases. The aim is that this book will be available to all women, especially the young women, so that they will understand what breast is and what breast diseases are.
Okay.
The aim is that we will develop a generation of women who have no fears around breast cancer. And if we have that, then we can find the disease early, and then we can give the treatment when it's necessary. And truth be told, if we have a young generation that is breast aware,
Right.
they're going to influence the people ahead of them and those behind them. And Ghana would be the better. Ghanaian women and the few men would be better off.
Thank you very much, Prof. Thank you, Doc. Thank you, Madam Mona, for joining the conversation. Those who joined us, Professor Jonat Clegg-Lamptey. He is Professor of Surgery at the University of Ghana Medical School. We also have Dr. Na Doko Aite, Senior Specialist Oncologist, Oncology and Radiotherapy, and Madam Barbara Doona, a survivor. It's Pink October. We'll be back with more on this same subject. Do stay. We'll be right back.